Well, experienced nurses in Queensland who were stood down after refusing to get the COVID vaccine during the pandemic are now being sacked from their jobs despite the state government lifting the vaccine mandate in September last year. And what a ridiculous situation when you have a shortage of nurses and frontline health workers to sack them for something that is no longer an issue. Well, one of those nurses is Ella Leach. She's the Secretary of the Nurses Professional Association Queensland, and she joins me now. Ella, I mean, this couldn't have come at a worse time for you, given that you're just about to have a baby. To receive that letter from your employer after the mandate has lifted must have been galling.
Okay, look, nothing really prepares you for it. I mean, you know it's on the cards as long as the disciplinary process is happening. I'm 7 months pregnant nearly. I should be focusing on the joys of becoming a first-time mum, but it's overshadowed by this process, but it's overshadowed many happy events over the last 2 years. So it's just the way it's been, unfortunately.
I mean, it just seems entirely nonsensical. You lift the mandate, so it shouldn't be an issue. Why would the state government continue to go after people who are now no longer in breach of any rules?
I think that they're just trying to double down. I mean, they're trying to prove a point with us. There's no sensible reason why they would continue with this action. We know that our hospitals are screaming out for staff. We're seeing ambulances ramped outside, people dying in ambulances. Our rural areas are really suffering, but they just continue and they will not engage on this issue. I don't know why they bothered to drop the mandate if they were going to continue firing people. I'm one of at least 50 since September 25.
I mean, it just seems like pure vindictiveness, to be perfectly honest. Now, we went to Queensland Health today. They told us in a statement, quote, Children's Health Queensland is unable to comment publicly on the employment situation, including disciplinary action of any individual employees. Employee disciplinary matters are managed on a case-by-case basis and governed by robust and equitable processes. But they've also said mercifully, Ella, that nurses who've been sacked can reapply for their jobs. I mean, how insulting is that? To say you're not in breach of any rules, but we're going to sack you anyway. But if you want your job back, you can come and ask us for it. I mean, is this some sort of weird thing where you're meant to go back and beg them and apologise and say, I'm very sorry? It just seems bizarre.
Look, in my response to my threat of termination letter, I think that was probably the third show cause I've received in 2 years. They have asked some nurses, so obviously in my role as the secretary, I've seen hundreds of these letters and they say how they've done it on a case-by-case basis, but they're basically templated letters. They lift what you've written back to them and put it in your new one and say, oh, even if we don't address what you've raised as a concern, we don't think that we haven't taken it into account, and then that suffices as an answer. And then they just terminate you. It's just disgraceful that they've been doing this to so many people. They've destroyed so many lives. I've spoken to nurses who've lost their homes over this, been living in cars. If you were in a rural area and you were working as a nurse and living in the nursing headquarters, you would be kicked out. They were essentially homeless if they got stood down.
It's just disgusting for a rule that doesn't even exist anymore, and particularly for you, 7 months pregnant. I just can't get over how awful the whole situation is. Ella Leach, thank you for your time.